Thank you so much for joining in. And Ashok, I presume there are few more students who are still joining in. But in the meantime, we can certainly start with the session. So, a very warm evening to all of you. And I would like to introduce our guest for the day's session. And with over 22 years of experience, Mr. Ashok has developed expertise in business growth, strategic planning, and new product development across key roles at industry leaders like Dr. Reddy's, Novartis, and Fulford India. His broad skill sets his broad skill sets include spearheading strategic development, launching product, and managing key stakeholder relationship. As a business head, he excels in leading multidisciplinary teams, adapting to market changes, and driving business success in dynamic environment. He's committed to fostering collaboration and driving excellence in achieving strategic goals. So, students, I today am very honored to present you Mr. Ashok VK from Dr. Reddy's. Sir, the podium is all yours. And students, I would request that you seize this moment and ask as many questions as possible, because this session is going to be a very enterprising and learning. It would be a good learning experience for all of you. So, Ashok, all yours. And thank you so much for taking out the time to speak to our students. It means a lot to us.
Thanks, Shweta. So allow me to share my screen.
Yes.
Yes, sir.
Okay.
Yes, sir.
Yeah. So thank you, Shweta, once again. The topic I am going to speak on is navigating trends and challenges in oncology market, insights from the field. This, obviously, this is a very broad topic. However, I have tried to cover the key aspects of it. And the most important point in this is that I will request you folks to ask questions, because there are a lot of stuff in this subject which I cannot put on slides and explain. Rather, I will respond to the questions. That will be more helpful. And once again, thank you for the Clinilaunch team and Shweta. So one disclaimer is that the insight and learning shared are my personal views, and it does not represent the view of my employer, Dr. Reddy's. So let me start by asking a very, very simple question. How many of you know about cancer, and why cancer has become such a big topic of discussion today? Any idea? Why do you think it is such a big topic today?
Actually, the cancer is a kind of a disease which occurs because of a continuous division, the uncontrolled division of cells, and it has basically the two types, the benign one and the malignant one. Benign one is not that much dangerous, we can say, but malignant, it can spread from one part of body to another. And it's a big topic nowadays because it's a we don't have a particular medicine for that malignant one, and most of the cancer is not fully curable, and because of today's lifestyle, it's getting a common, we can say.
Okay, thanks. Thanks, Aditi. Thank you.
Yes, Aditi. Thank you,
Thank
sir.
you. So the points which you mentioned are very real. So cancer is a very big topic today, because cancer is part of non-communicable diseases. The other non-communicable diseases are like diabetes mellitus, hypertension, stroke, and cancer. Now, if you look at India's history and evolution of how the Indian healthcare has evolved, or how the diseases have changed over a period of time, when we got independence in 1947 to almost the year 1990, the rate of infectious diseases was very high. The number of people every year who died because of infectious diseases were very, very high. But over a period of time, because of the improvement in healthcare infrastructure, vaccination, improved access of the hospitals, the number of people who die because of infectious diseases has come down, and the number of people who are actually affected by non-communicable diseases has gone. This is happening globally in developed countries, as India is also moving towards a developed country. The rise of non-communicable diseases is very, very high compared to infectious diseases. Among them, if you look at diseases like diabetes, hypertension, they have a long-term management plan. A person who's diagnosed with diabetes has several options of treatment: oral hypoglycemic agents, insulin, and now so many modern drugs. And for hypertension, there are so many new drugs which are available. However, cancer is a condition which is not so simple. It is very complex, because cancer, of course, like simply classified as benign and malignant. Benign we will not speak about. Most of the cancers are malignant, and these malignant cancers are of different types. They are classified based on the cells, type of cells they arise. And each type of cancer has a different prognosis. And in India, if you look at this slide, the most common cancers are head and neck cancers, lung cancers in men, breast cancer, cervical cancer, and ovarian cancer in women, and gastrointestinal cancers common for both men and women. And particularly the gastrointestinal cancers, when we talk about, we speak about two different types of cancers. One, gastric cancer, which is stomach cancer. Second is colorectal cancer. So gastric cancer and colorectal cancer are different entities. Colorectal cancer incidence is increasing in the recent past due to the lifestyle change. That is essentially intake of more processed food, and the chemicals in the food are leading to an increase in colorectal cancer. While gastric cancer, stomach cancer continues to grow because of the various reasons, which are not very clear in sometimes which are very, very clear, like in northeastern part of the country and Jammu Kashmir. Jammu Kashmir and Northeast, where the meat consumption is very, very high. So the other important challenge with cancer in a country like India, if you look at this slide, in this part, most of the cancer in India is diagnosed in advanced stages, which is called as stage 3 and 4. If it is diagnosed early, the cost of treatment is very less. When the moment it gets diagnosed higher, the cost of treatment becomes very, very high. In India, the reason why the diagnosis happens late is the lack of awareness and lack of screening. So the number of people who get screened and number of people who go to the doctors when they have the signs and symptoms are very, very less. Only in the recent past, there is a increased awareness about breast cancer. And that's the reason the number of breast cancer cases which are diagnosed in earlier stages are going up. Otherwise, cancer continues to be diagnosed most often late, and that leads to not only higher cost of treatment, it also leads to poor prognosis. The patients don't do well when they are diagnosed later. So if you look at this, what are the options for treating cancer? Cancer usually is can be treated with 5 different ways, either alone or in combination, depending on the cancer, stage of the cancer, and type of the cancer. So the first and most effective one is the surgical option. Surgery is done when the cancer is diagnosed very early, and it is more often very effective. Then the patient is usually given radiation. In some of the cancers like head and neck cancer, in brain tumors, and in some cervical cancer, radiotherapy is the very good option. Then for some specific cancers, like breast cancer with hormone receptor positivity, and ovarian cancer and prostate cancer, hormonal therapy is given. Now, in the modern era, most of the patients receive chemotherapy and targeted therapy. Anyone, can you tell what is the difference between chemotherapy and targeted therapy?
Chemotherapy will be given in the form of saline to the entire body to circulate inside to the dissolve in the blood flow. And the target therapy will be specific one part of the body. The treatment will be given for the affected area directly.
Okay, that is partially right. Anyone else?
Immunotherapy is a type of targeted therapy.
Okay, also.
Certain kinds of proteins are targeted that are like target or those proteins are probably the markers of that kind of cancer. Maybe in diagnosis, those are used as markers. So particular antibodies can be used targeting those proteins to and maybe drug molecules could be delivered in that way so that the entire body is not affected, as in case of chemotherapy, which might reduce cases of cancer remuneration, maybe.
Okay, quite good attempt. So,
Yeah.
yeah,
So
go ahead.
actually, yeah, maybe targeted therapy. Here we use drugs. We used to identify and attack. We attack to certain types of cancer cells. It is given along with chemotherapy, sir.
Okay. I think I want to compliment all the people who respond to the questions, whether it is Deblina, Ummi, or Sampath, or earlier Aditi, because none of us know everything. Whatever we know, when we speak, it gives an opportunity for us to clarify ourselves and learn better. So thank you, folks. So the chemotherapy essentially means administration of drugs which are toxic to the cells. These drugs do not differentiate between the cancer cells in the body and fast dividing cells in the body. So, for example, which are the fast dividing cells in the body? Our body has very fast dividing cells in the stomach, in the intestine, in the skin. So, when such, and also in the bone marrow, when chemotherapy is given, all these, along with the cancer cells, all these fast dividing parts of the body are also affected, and the patient have side effects. So some of the patients' blood count goes down because the cancer cells, along with cancer cells, even the bone marrow cells are killed. Patients have severe diarrhea. Why? The layer of the gastrointestinal tract, which contains the fast dividing cells, is also killed. So that's how the chemotherapy works. It doesn't differentiate between the cancer cells and the normal cells, body cells. However, in targeted therapy, what happens is that cancer cells have something called as a growth drivers. These growth drivers are on the cell surface of the cancer, which are very specific targets. And there are drugs which are made against these specific targets, such as one of the example is a tyrosine kinase inhibitor. There is a marker, or there is a receptor called as EGFR on the lung cancer. So if the patient is positive for EGFR and the patient is then treated with a drug like geftinib or erlotinib, that goes and specifically binds to that EGFR receptor, thereby killing the cancer cells. It doesn't affect the normal cells. In the same manner, in some patients of breast cancer, There are marker called as HER2. When HER2 is targeted by specific monoclonal antibodies, it goes and binds to only HER2. So, and there are some specific markers like tumor ligands, which are programmed death ligands, which are on the cell surface of lung cancer, gastric cancer, head and neck cancer. When the patients are treated with drugs such as nivolumab and pembrolizumab, they go and bind to only one of them and kill the cancer cells. They don't affect the other cells much. Because they go and attack a specific target on the cell surface of the tumor, they are called as targeted therapies. Am I clear, or are there any questions on this on this point?
Sir, I have one question. It's
Yeah.
Aditi.
Yeah.
Sir, as you explained that chemotherapy and target therapy both are different, so that means the chemotherapy is much more affected. We can say we can face lots of loss in this therapy, right? As compared to target therapy.
Chemotherapy, see, this is an evolution. So 10 years back, most of the treatment was through chemotherapy. In the past 10 years, because of the change in the science, there are many targets which have been identified, and there are drugs which are targeting these markers have been identified. Hence, the treatment has become like more precise. Earlier, chemotherapy is like carpet bombing. Now, when you use a targeted therapy, it is like a precision bombing. You know where is the target, you are sending the drug, and the drug you know that will go and attack only the cancer cells. So it has become more safer and more effective when you treat the cancer with a targeted therapy. Still, chemotherapy has its role and it is used many times in combination with targeted therapy. But targeted therapies are slowly becoming more and more effective, and they are getting more and more used.
Okay, sir. Understood very well. Thank you.
If you look at the Indian oncology market, that is the market of India, it is valued around 7,200 crores, and it is growing every year by 20%. And 55% of this value is coming from around 15 multinational companies which are operating in India. The oncology market growth is fueled by innovative new drugs. There are approximately around 62 companies operate in oncology space. There are several small companies which only work in the government tender segment, excluding that around 62. There are around 1,000 medical oncologists. Medical oncologists are those doctors who treat the patient with chemotherapy. They are qualified to treat patients with chemotherapy and targeted therapy. These are called as medical oncologists. There are around 600 surgical oncologists who do surgical work and remove the cancer. And there are around 2,500 radiation oncologists and around 350 hematologists in the country. And around 600 government hospitals are there, and around 350 corporate chains are there, and there are around 500 standalone hospitals are there, which majorly focus on cancer. There are several state governments such as Tamil Nadu, West Bengal, Assam, Madhya Pradesh, Rajasthan, Kerala, Odisha. These all procure cancer drugs and provide free to the patients. Why this information is recent? The Prime Minister's healthcare scheme has enabled a lot of patients to get access to the cancer treatment across the country. So earlier, around 5 years back, the number of patients who were getting treated was much lower. But in the recent past, because of improvement in healthcare access, the number of patients who are getting treated has improved significantly. So what are the major trends which are shaping the market? So the first one is improved availability of advanced diagnostic tests. Why this has happened? Because there are more and more diagnostic companies are providing them at a lower cost. Some time back, we spoke about targeted therapy and chemotherapy. To know the targeted therapy, you have to do a test, many tests to find out what are the targets, what is the tumor targets are available, which are the markers in the tissue. And these advanced diagnostic tests are now available in India at a fraction of a cost. What usually costs somewhere around 50,000 to 1 lakh in the US costs approximately around 20,000 in India. And in India, because of the government regulations, the biosimilars and generics are available immediately after the patent expiry. And now more and more targeted drugs are available. And most importantly, other than treatment of the cancer, doctors are also focusing on improving the health-related quality of life of the patients. That essentially means how do you manage the side effects and make the patient feel better. And another important thing is that how the patient's behavior is changing. 5 years back, most of the patients, if they were diagnosed with cancer, they used to rush to big cities like Bombay, Delhi, Chennai, Calcutta, Hyderabad, Bangalore for getting treatment, because at the time majority of the hospitals were in these big cities. Now even tier 2, tier 3 cities have very good cancer treatment centers because the number of medical oncologists have moved and the government has also increased the infrastructure. So today, if I take a state like Andhra Pradesh, there are medical oncologists who are available in a city like Bhimvaram, Rajahmundry, and in a state like Madhya Pradesh, there are medical oncologists who are available in a place like Jabalpur. And in Uttar Pradesh, there are medical oncologists who are available in Kanpur, who are available in Banaras. Earlier, these places didn't have doctors to treat. Now, more and more doctors are available for treatment. And also, COVID had a huge impact on the healthcare system as a whole. The COVID has given confidence to the patients to get treated at the local centers. I have seen that the local doctors are treating them as good as the consultants in big cities. And advent of healthcare schemes such as Prime Minister's healthcare insurance has improved the access to the patients. And more importantly, the knowledge dissemination has become faster because of the adoption of digital tools. More and more physicians are using digital tools. More and more patients are accessing digital information to know about their condition and discussing. These are some of the major trends which are shaping the market. So I would stop here and I would encourage you to ask questions if you have it. So let me ask you a question. You guys are studying in Clin Research. So I have shared some information with you so far. Now, how do you think it is relevant to you?
Sir, we are learning about the clinical research. So the
Okay.
data which we get here will help us to understand how the future is going to come, or where can we see our possible opportunities like that, and all we can connect, sir.
Okay, that's very good, Soumya. Anybody else?
We can gain the knowledge and implement further if we are doing this job in this field, and it will help us for career to this career.
Fine. Anybody else?
We can do more research on early diagnosis of the disease.
Okay, that's good, Dr. Kishwar. So
new ideas and new more treatments can be done through meetings and all those, sir. Because of spreading the knowledge, spreading the awareness and everything, we can gain even more
Okay. So one important thing from my perspective, oncology is the area where worldwide huge number of clinical trials are going. You have any idea how many clinical trials are going on in oncology drugs worldwide?
No, sir.
Okay, which are the which are the sites you go to see about clinical trials? Which is the clinical trial site for India? You guys all have access to Google.
Yes, sir.
So have you visited a site called CTRI? So what does CTRI do?
It will upload the information related to the Indian clinical trials, where it was going, how it was going, what is the trials main primary like primary endpoint, secondary endpoints, how many kinds of trials are going on throughout the India. That will give the more information in the CTR website, right? More information related to every trial.
Very good, Sampath. I think that is appropriate, accurately captured. What about the global clinical trials? How do you find the global clinical trials?
That is clinicaltrial.gov. Something is there. That is a
Yeah.
main website which is maintained by NHI, right?
Correct.
We can get more trial in detail related to how many subjects, what is the eligibility criteria, and what is the primary endpoint, how is the uh, drug was given, distributed, and how many arms are there. Everything will be stored in that website. We will get different kinds of filtrations, like we can search by disease, or it can be searched by the diagnosis, medicine, if we know any kind of medicine. More, it will be available through that website.
Very good, Sampath. Very good work, Sampath. So the reason why oncology is important is oncology worldwide, the clinical trials which are going on are more than 2,500 clinical trials are going. And every day there is something new in oncology. And clinical research is the foundation in which oncology new drugs are built and they are launched. And oncology is the area where the innovation has seen so many new things which are coming up. Some of the diseases which were not thought to be controlled have become like a very commonly manageable diseases because of the clinical research. How many of you know about a drug called imatinib? Any one of you? Okay, I'll just tell you. There is a condition, there is a disease called as chronic myeloid leukemia, which is a type of a blood cancer. This blood cancer was a deadly disease with no cure around 14 years before. One simple chemical drug, which is a first targeted therapy called as imatinib mesylate, was discovered, and that actually changed the management of this disease. From a deadly disease, it became a manageable disease. Patients were not surviving more than 2 years. Now there are several patients who are on the drug for more than 10 years. That is the power of the work which is happening in oncology. So if you guys are all doing clinical research, you are studying clinical research, it's important for you to understand where this therapy is going, because it will give you a good opportunity in terms of your career. Okay, I'll move on to the next few slides. So if we have to really look at the oncology market, and if we have to become a leader in oncology market, what are the ways? The first way is introduce innovative drugs. And that's how many of the multinational companies such as Roche, Novartis, Pfizer, all introduce new drugs which provide them with high amount of revenue. But you can't always introduce new drugs and gain leadership in the market. What are the other options you have? So there are some important learning from the market. One, be first in the market. If you are first drug in the market, first biosimilar, first generic, you can get a good amount of the market. Then Indian patients are slightly different. So you have to adjust your offering to Indian patients. Focus on some very niche areas where others are not focusing, and then focus on patient services. I'm just going to give one example each so that it is important. So because you guys are doing clinical research, I don't expect you to read this book, but I'm just suggesting that this book is freely available in the net. There is so many commentaries on this. There is summary of this book in YouTube. Whenever you have time, you guys please read this book or listen to the summary of this book. So there is a book called 22 Immutable Laws of Marketing. I suggest that you guys take some time and look at this very small book. And the first law of marketing in this book says is that it's better to be the first than to be better. So if you are first in the market, your market share, the amount of money you will make by being a leader will be higher. So there are some examples in Indian market. So the first generic imatinib was from a company called as Natco, which is with the brand name VNAT, which is a market leader. First biosimilar rituximab was Reditex, which is from Dr. Reddy's. First biosimilar bevacizumab was from Intas, and first generic gefitinib was from Natco. All these, because they were first to the market, they still hold a huge amount of market share. So what here I am talking about is that if you are the first drug to be available in the market as a generic, you will have a huge amount of market share. So there are some examples I have given. Imatinib, first generic imatinib, first biosimilar rituximab, first biosimilar bevacizumab, first generic gefitinib. All these are from different companies which have been
Gefitinib is usually for EGFR mutations like
Yes.
19
So the second point is that how do you make sure that you serve the Indian patients better? You all know something called as a BSA. What is a BSA?
There's a protein Bhavan serum only.
No.
Sir, body surface area.
Yes, body surface area. Why body surface area is important?
The dosing will be based on
So
that.
based on the height and weight, we calculate the dose.
The dose.
It's absolutely right. So the dosing is based on the body surface area. So what happens is that many of the drugs which are introduced in India are introduced as they are introduced in the Western market. But because cancer drugs are very expensive, there is a huge amount of wastage. If as a company, they do the innovation and bring very specific dose to Indian patient, that company is respected by the doctors. For example, there is a drug called bortezomib. You guys know what or why, from where this bortezomib is used for treatment of which disease?
No, sir.
Okay. So bortezomib is used in treatment of a condition.
It's used to treat
lung
multiple
cancer,
myeloma.
multiple myeloma. So the standard dose in the West is 3.5 mg because the body surface area in the West is higher. So the patients require 3.5 mg. Indian body surface area is lower. So only 2 mg of drug is enough. So many companies have introduced a single vial of 2 mg, thereby saving the cost to the patient and the government. Same thing with rituximab. In the West, the body surface area is higher, so the patient requires 700 to 800 mg. In India, only 600 mg is. In the similar manner, trastuzumab in India, good number of patients will do with 375 mg versus a standard 440 mg in the West. So those companies which take initiative to do some research and introduce a lower strength always get a higher market share and higher respect. And there are some companies have succeeded by focusing on some very specific areas. Some of the areas like only preventing nausea and vomiting is a focus area, or drugs which are orally taken. These are all strategies which company adopt to win in some specific segments. And finally, most important is the patient services. We just discussed about the advanced diagnostic tests. So many companies offer either subsidized or free testing of the specific targeted drugs. Like KRAS testing is used to identify patients who are right patients for colorectal cancer treatment with a drug called as Vectibix. And HER2 is a test which is required for treating patients with trastuzumab. There is a protein called as ALK that is tested in lung cancer for treatment with crizotinib. And there are many companies offer patient assistance program by giving free medication to the patient for making sure that the patients have good amount of outcome when they are treated. Because Indian patients, most of them pay out of pocket. The government's support is only 30%. 70% of the patients are paying out of pocket to get treatment. And finally, one of the most important thing is how do you differentiate, create ecosystem in the market? Because most of the physicians want to diagnose the cancer patients early. They have to create awareness. Why creating awareness about cancer is important? Any idea?
Creating awareness, it directly associates with the diagnosis early, so that the treatment, everything is very effective in case of early diagnosis, and the prognosis is also good if we get diagnosed early. So that is the reason we are
yes, excellent, Soumya. So who actually diagnoses cancer first? Who diagnoses cancer or who suspects cancer? If the patient has a symptom, so the patient goes to whom first?
Clinician, sir.
Doctor.
General physician.
Yeah, okay, Danya, correct. Family
General
physician.
physician, sir.
Family physician. So family physician cannot confirm that it is cancer. The patient has to be referred to a specialist. But to refer to a specialist, the family physician should know the signs and symptoms of cancer. And one of the challenges the family physicians have is that they are not taught at MBBS level about the signs and symptoms of cancer. So they learn when they start practicing. And one of the challenges in a country like India is that many cancer signs and symptoms are similar to that of other diseases. For example, what is the most common infectious disease of the lung in India?
TB.
TB. Most of the time, the symptoms of lung cancer mimic that of TB. So if the patient goes with a cough and sputum to a family care physician, what will be his thought process?
He might think it is TB.
Yes. So Priyanka, it is right. The doctor will think it is TB and he will be treated for TB. And when the patient doesn't respond for 3 to 4 months, then the doctor will realize that something is wrong and then he will send the patient to the next level. By the time the patient's disease has progressed. For example, ovarian cancer, which is one of the difficult cancers to treat. What are the common signs and symptoms? You are aware?
Cyst in the ovaries.
Yeah, ovarian cancer. What are the signs and symptoms? What does the patient feel?
Swelling and pain.
Pain.
Pain where?
Lower abdomen.
Lower abdomen.
Dr. Kishwar and Priyanka, pain in the lower abdomen is one. The patient.
Even there is bloating and there's a lump that is found as well. And then there's like fatigue. Even weight loss can also cause, like it's a symptom of ovarian cancer.
Correct. Noreen, correct.
These are menstrual irregularities, menstrual problems we face.
Fine. So the most common symptom, like you said, bloating and some discomfort in the abdominal area. Suppose a woman who's around 50 years goes to her family physician with the complaint of bloating and stomach pain, what will the doctor think?
Gastritis, sir.
What is it?
Acute gastritis.
Acute gastritis. Yes. The doctor will think there is some gastrointestinal disturbance, and what will he give?
Antacids mostly, sir.
Antacids, PPIs. And he will send the patient. The patient will have some temporary leave and again the patient will come. So by the time the patient, doctor suspects something, the patient would have advanced. So there is a gap in the diagnosis. So most of the oncologists want that most of the family physicians should know about the signs and symptoms of cancer and when they should refer to oncology. So any service done in this field will help patients to be diagnosed earlier, and it will save the country and the patient a lot of money and effort. So many of the pharmaceutical companies, including Dr. Reddy's, is working in this space to create awareness amongst the primary care physicians, among other specialists, so that cancer patients are diagnosed early. So this differentiation in service makes the doctors respect the companies very much, because once a patient comes at a very advanced stage, there is very little a doctor can do, and it has a huge impact on the country and the patients. So differentiation in marketing by doing these services helps the patient, helps the doctor, and helps the company as well. These are some of the aspects. So from my perspective, that's all. I don't have any more slides to present. So I am open to few questions you guys have.
Sir, Soumya here. Thank you for the very wonderful presentation. Like, it was an eye-opening session. So my question is like, sir, since we are dealing with a lot of carcinogens, like what are the few basic steps that someone should follow to avoid all those, which are things we are very commonly using it in our day-to-day life, but it's very dangerous. So some precautions like that, sir.
So first of all, high amount of processed foods is one of the leading reasons for cancer, not only stomach cancer or colorectal cancer, many cancers. So if we look at the cultural shift which is happening today, what we are seeing, there are many of us have shifted our majority of the food habits from home cooked food to food which is available outside. So those foods are cooked. How, what chemicals are used, we don't have any idea. So if you see now, there is a craze for people eating shawarmas, biryanis, and all the deep fried food. So these are all, if it can be done in moderation, it will help the reduce the risk. Second thing is exposure to pollution, and also exposure to plastic. The amount of plastic we are using is very high. We should try to reduce it. The storage vessels where we keep milk, curd, all that should be metallic rather than plastic. And of course, lifestyle changes, like, of course, many people don't use alcohol or smoke. If they are doing it, they should stop doing it. These are all some factors which can help reducing the risk of cancer. You can't say you can prevent cancer. You can say that these are all the factors which can help you to reduce the risk of cancer.
Sir, considering the food, I also have one more doubt. Like, there is a huge thing going on. Like, so if you eat overcharred food, or if you eat the food which is cooked in the air fryer, so there are a high risk of carcinogens. So how do you see it, sir?
I'm not very sure there is a evidence for that. So air fryers are a recent addition to our, what I can say, our lifestyle. So I'm not very sure this is going to be resolved so soon. The same thing people told about microwave oven, but there is very little evidence to say that only microwave oven or microwaving food can cause this. So I don't think so. There is enough evidence. Whatever we speak, no, we should speak based on evidence. There is very little evidence. One of the other lifestyle factors which can lead to increase in risk of cancer is the increased consumption of sugar. The amount of sugar which is getting added in our life today is something like what we consume in a week is like what our ancestors would have consumed in a month. So the amount of sugar consumption needs to be done in moderation because it's one of the risk factors for cancer.
Thank you, sir. Thank you so much.
Hello, sir.
Yeah,
Thank you, sir, for the very informative session, sir. I got so many insightful points from this session, sir. And my doubt is sir, is hereditary is also part of cancer that we are in generation by generational spread like that, sir? How it is the hereditary is the part of? Can we say about this, sir?
So hereditary cancers are relatively rare. So when you talk about hereditary cancer, Danya, which cancer you're talking? Which hereditary cancer?
Sir, I'm not very sure, like the brain tumor or breast cancer, all these things, sir. Because in women, like it is most common, right, sir, the breast cancer. So
yes,
that is, yeah, that's my question.
So breast cancer, there is a gene called as BRCA. Breast cancer gene.
Yes.
That BRCA gene is responsible for some types of breast cancer. And there is a test available today. If you have any close woman relative who's suffering from breast cancer and you want to know the risk factors, you can get yourself that BRCA test done. That BRCA test will show that whether that BRCA gene, mutated gene is in your body or not. But most of the cancers are not due to genetic disease, genetic conditions. They are due to a mixture of environmental factors and body. It is not only genes.
Okay, sir. Got it, sir. Thank you.
And
Hello,
also,
sir.
so does use of sunscreen really helpful in prevention or?
So see, in India, all of us, most of us, I will say, are blessed with a high amount of melanin in our skin. We usually don't require sunscreen unless somebody is sunbathing for a long time. So unless that is there, the use of sunscreen is very, very not much necessary. Unless somebody is going and standing in the sun for hours together, only those people should use sunscreen, or they are very, very fair. But fortunately, most of the Indians like us are having a good amount of melanin in our skin, so we don't require a sunscreen.
Hello, sir.
Yeah.
Sir, this is Dr. Ambika Bhera. I have a
Hi,
question.
Dr. Ambika. Yeah.
Hello, sir. It was a very interactive session, sir. I'm like I learned a lot from you. And actually, my question is, if you visit nowadays general physician, almost like many people they're going for the bloating. Almost everyone is like having a problem of bloating. So how for a general person, like suppose me as myself, how I'm going to differentiate whether it is bloating, simple bloating, or something else like cancer?
So, Dr. Ambika, you must remember that not all bloatings are cancer. So first you should look at the age of the person. What are the other complaints that person has along with bloating? Suppose there is a woman who is 45 plus, who has had repeated histories of bloating and who has some abdominal pain. Then immediately you should consult a doctor and get a ultrasound scan of the abdomen done as a first step. That doctor himself will tell that if it is a complaint of so many days, you should get an ultrasound done, which will clear the doubt why the bloating is happening. Or alternately, if the bloating persists, you should visit a gastroenterologist. The gastroenterologist will confirm whether it is due to problem in the gastric condition, gastric stomach, or it is due to something else. Now I'll take the last two questions and then I'll have to leave.
Hello, sir.
Yeah, Priyanka.
Yeah, so this is Priyanka. I just wanted to ask, because nowadays I'm seeing like around me, there will be many people who will be like, find any lump. So there are two types, right? Benign and malignancy. So any person randomly he will found any lump in their body. So directly they feel like it is malignancy or like, oh shit, this is cancer or what. But when we go to the doctor, they will like say, no, this will like proper diagnosis is not there. So any proper diagnosis to differentiate between malignancy and benign. So I just wanted to ask, and in women, breast cancer is the common cancer in women. So for example, any woman saw any lump in her breast, so to whom she should consult, like gynecologist or the MD doctors? So these are my two questions.
So the first and foremost thing is any lump. There are lumps which can happen due to the hormonal changes. So that is a normal process of the body. So first doctor to discuss will be a gynecologist, and if you are not satisfied with the gynecologist's response, you should ask the gynecologist to refer you to get a mammography done. That is a best choice because the mammography will at least show what is exactly happening.
Okay, and some of the doctors, they also suggest FNAC, right?
No. The first thing is if there is a lump and if there is a suspicion before FNAC, it is better to get an imaging done. Imaging done means whether it is a ultrasound or it's a mammogram, it is important to get a mammogram done. There should not be a FNAC before imaging.
Okay, sir. Thank you, sir.
Sir?
Yeah, Umi.
Yes, I just wanted to know, sir, like how much are the chances for a benign tumor to be turned into malignant? Example, like if there are lipomas and now they are benign, so can we accept some like they can turn into malignant? Is there any any year?
So it depends on the location and the type of benign tumor, Umi. So if at all there is a tumor which is diagnosed as a benign tumor, it is better to get a doctor's opinion to get it exactly diagnosed to check whether it is going to turn into malignant or not. There are tests available. An oncologist is a better person to test it. So there is nobody else should do it.
Yes, sir. Okay, sir. Thank you.
I once again thank Clin Research and Shweta for giving me this opportunity. Thank you and have a wonderful week ahead. Thank you.